you so much for joining us today. I am really excited to jump into today's presentation and introduce my co-presenter, April Salazar, who's the provider of business development and manager at Keck Medicine of USC, as well as myself, who serves as a director of customer success here at Clarify Health. So with that, we'll go ahead and get started. Like we said, really excited to share a real-world case study with you all today on strategic physician outreach. April and I have been working on this project for quite some time and are really excited to share with you some of the early results as well as what we've learned throughout this presentation and throughout this project. What are some of the things that maybe we want to include as we go through, as we think about redoing this as the upcoming year? And what are some of the successes that April's team is going to continue to keep on as she moves forward with the assignment? I did a high-level introduction. So April, I'll just let you say hello before we jump in quickly.
Yeah, thank you, Christiana, and welcome everybody. I'm so excited to be sharing this with you guys once again. For those who didn't have the opportunity to attend in person, you now have the opportunity virtually, and we get to actually share a lot more information with you now. Some of the feedback, progress on how it's been going as part of this project, and where we're moving towards in the future and currently. Thank you.
Wonderful. So for today's conversation, we're going to cover a couple different things. We're going to start from the beginning and share a little bit of background about who Keck Medicine is and who Clarify Health is. We're also going to talk through some pain points that some of you on the webinar today may resonate with, that we found are pretty similar across physician liaison teams we've both worked with. Then we're going to really translate into what did we do for the problems that we found. We're going to talk through how we leveraged both internal as well as external claims data to provide analytics to April's team about how to assess her physicians. Then we're going to talk about how we began tracking ROI really early on in this project, so that way we can continue to see the overall growth and improvement as well as what's not going well with the project while it's progressing. Finally, we'll end with some lessons learned and best practices. Like I said at the beginning, this is an evolving process. And for many of you, you're probably aware that as you're thinking about how you manage your physician outreach strategies, we always want to be striving for better and improving based off of our conversations. And that's something that April and I have spent a lot of time talking about, is what do we continue to keep as we're progressing this forward, and what do we want to change based off of some of the lessons we've learned. And then finally, April will actually wrap up sharing some of her recent conversations with some physician focus groups that she's been hosting to get some of that physician buy-in as they've rolled out this project. So with that, we'll actually start with some of that background. So April, I'll hand it over to you to talk a little bit about Keck.
Yeah, thank you, Christiana. So Keck Medicine of USC is a 401-bed acute hospital. We also have a sister Norris Cancer Hospital, which is 60 beds. We are also part of a larger ecosystem. It includes Verdugo Hills Hospital, 158 beds, and then we have USC Arcadia Hospital that we recently acquired last year, 348 beds. So all combined, we are 4 hospitals. We also have a branch of USC Care Medical Group. Those are our faculty physicians who work with the community physicians throughout some of the hospitals in the area, as well as provide satellite services throughout all of our clinics across 30+ specialties. We have 40 different outpatient clinic sites. Some of them are specialty based, others are multidisciplinary based, and they range all the way from Los Angeles Bay Area, where we are based, all the way up to the Central Valley and a couple small satellites in Northern California. And thank you,
Great.
Christiana. I will punt it back to her to share the wonderful things about Clarify.
I was going to say, talking a little bit more about Clarify and who we are. Clarify Health is an organization that works with health systems and hospitals across the country to use analytics to really provide better care and enable organizations to have more precise growth strategies as they're looking to organize where are they going to focus their efforts. The way that we do that is by partnering with claims data, and we actually draw upon our longitudinal data set that provides insight into over 300 million plus lives across the country. We tie that data together so that way we can really follow how are patients falling in and out of the system. What does that pathway look like across the overall continuum of care? Where are patients coming into your system? Where are they coming out? And what are the overall outcomes? We utilize several benchmarking different techniques in order to identify how physicians are performing, as well as linking physicians to one another to start to infer those referral patterns. Overall, April and I have been working together for quite some time, and where we've really come together is focusing on giving those analytics into the outside world that can help inform her team's strategy. So we provide that information at a physician level, so that way you can go into a new provider office visit or walk into a new specialty clinic and really have insight before you step into the door of who that physician is, who refers to them, where do they send their patients for, and what types of procedures do they do. For today, we came together, and April and I have been talking a lot about, where have, the biggest pain points come? And that's really where Clarify looks to solve for a lot of challenges that are being faced in the industry today. So we have a little bit of a poll for you this morning, and you should have to pop up on your screen shortly. But there've been several different pain points that we've heard over the years in our time working together that we're curious if they resonate with this group. So April should be pulling up a poll that'll pop up on your screen now. Look at these different options. Let us know and check off if any of these resonate with some of the different challenges that you're facing. And we know this is just a short list, but it could be if you have inconsistent or siloed data about your physicians. One data set's telling you something about your providers and one's telling you something else. You also may have, your data team spending lots of time actually manually mapping their outreach efforts with referral data in order to tie that message. You may be working with an organization where your vendor data and your internal data paint totally different pictures about a physician activity. Or you may be somebody who focuses on the same physicians every year and isn't refreshing that list, isn't talking to who are the new providers that can actually gain your organization business. So go ahead and take some time to fill out that poll and let us know if any of these resonate with you.
Thank you, Christiana. And if there's anything you see in the poll, perhaps that is an expansion upon some of these areas, feel free to drop it in the chat box. We're all here together. We experience the same challenges, opportunities, and events really in our day-to-day lives and the work that we provide. We'll give it another 30 seconds or so just to make sure everyone has a chance to select it. All right, with that, I will be closing out the poll. If anyone wants to get in last minute votes, I will be closing that right now. All right, I'm going to go ahead and share these results so that we can move into the next part of our presentation and we can share with you some of the interesting points that came out of this. All right, so it looks like here the largest majority votes really came from having inconsistent siloed data. Big surprise, which is why we are here today to share this with you. In order to make great predictions, you have to have one thing, and that is great data. And like many of us throughout healthcare, it is siloed and it lies in different areas. It pulls from different areas. Our goal in this project was to bring those two together, ensure that we have one picture instead of three. You can see here the next result was continuing to focus on the same providers and vendor data with data paint pictures. So what I'm gathering from this, it seems the common theme here is that We all have challenges with data, internal, external, different vendors, and having one consistent picture. And that raises the question, what do we do? How do we move forward in these challenges and provide a compass of outreach in order to make great predictions with our physicians, to have growth, success, and wonderful margins that we can share with our leadership around the work that we're doing? How do we move forward with that? So I'm going to pass it back to Christiana here to share with you a little bit around that.
Awesome. Thanks, April. And I think it's really helpful to hear. I know these are probably just some of the challenges that you're facing, but you want to ensure that you know as much about a provider before you walk into that door. And that's really aligned with the goals for leveraging Clarify Health Markets and Referrals platform. And when I came to work with April, it aligned with the three main goals that we were trying to solve for with her prior to her working with our team. So the first thing that we're looking to accomplish is to provide accurate physician profiles. Like I said, it's important to know, especially if it's a new provider, a provider you haven't met with, what is their overall referral pattern? What is their book of business? What are the diagnosis codes of the patients that they're seeing, particularly if those patients are outside of the four walls of your organization? It's also important to know, well, where are the referrals going to? So that way you can identify before you walk into the room, is a provider a splitter for certain service lines? Are they sending all of their orthopedic service lines to a competitor down the street? Is that for certain procedures? So that way you can inquire or bring up information relevant to a strong orthopedic surgeon that you have within your market. The second goal that we're trying to accomplish here is really provide that out-of-network intelligence on provider behavior. We know that in today's market, you may have many physicians that are splitting their behavior, particularly as we think through surgeons who may be working at your facility, a competitor, as well as an ASC. It's important to really round out their business to identify what is everything that they're doing, where is it taking place, and what are those services. We also want to understand if that provider is referring out of network. What are those procedures for? Are they to a particular physician who they have a strong relationship with? What can we inquire about that relationship that we now can ask about, given we have that additional data set? The third and final goal is to really prioritize those physician lists. In working with April, this is really the big one for this project. How do we utilize and identify a network of community physicians to identify, who are the right doctors, especially in a densely populated area, to go and partner with, and what do we talk about with them based off of the data and what we know about the market? So with that, that's really how we came to our relationship here. So I'll let April talk through a little bit more how we started to partner together and where we are now at a high level.
Absolutely. So a little bit of background on the timeline between our partnership. Previously, we were with another vendor for data analytics that starts with the three-letter word. Some of us may have used them. They were wonderful. However, we were really searching for a service that offered not only a concierge level of care to our reps. We are a service line based team of close to 10 people across 8 different service lines, but also insight that we couldn't find anywhere else into the physician profile. And the one thing we found that was lacking when we were looking for different vendors was nobody seemed to have a direct picture or insight or microscope into the physician profile. There was a lot of data around kind of the market landscape from a general standpoint, service line standpoint, but there was nothing really that told us what kind of business did that physician do? Who did he work with? Did he have preferences around facilities or sites that he did his procedures at, or was he a small private practice clinic? Clarify really provided us with the insight to have a full microscope into those physicians, which is what we were looking for. So last fall, we came together for a training on site with Clarify Health, and that's where we began applicating the platform features into our daily work. And the first challenge that we encountered on our first day, first hour with Christiana and her team was, well, we're a service line based team. How we have overlap. Some of the targets that I have may be the same ones that another rep or even perhaps 2 to 3 other reps have. And we all want a piece of the pie. We all want a piece of the cake. So who gets that cake first, and how big of a slice do they get? One of the solutions that we came up with during this time was identifying, you know what, let's take a backwards forwards approach. And rather than executing a service line based strategic plan, let's actually execute a plan based off of hyper personalization with the physicians that we're targeting. And that's where Clarify said, you know what, we can actually create a filter for you guys that would outline the top rendered services, top outbound services. So for example, if it's a family practice physician with a high orthopedic population, or maybe a high cardiac population, or perhaps even maybe he just has a mix of everything. How do we match that physician with the appropriate rep? And that's where we began the essence of this project was, you know what, let's hyper personalize it based on the physician rather than the service line that we are trying to grow. So we were trying to fit at the time a large box into a small round circle, rather than taking that circle and wait, no, let's just mold it like Play-Doh into what we need. This is our work. Let's shape it into the way that works for us. So the next step that we came from this, like I said, was piloting it throughout a service line. And we threw around different service lines on what we should do. And we came to the conclusion that orthopedics offered a couple different advantages. One, had very clean data. It had a nice picture of historical data. It wasn't a newer service line, or there weren't varying DRGs or CPTs or ICD-10s, coming out of it. And the third was we had a committed group of physicians who were really willing to work with our rep, who is wonderful, on executing a pilot plan for this project. And that's how our provider match project with Clarify was born. So as you can see, the first phase was our strategic planning phase. And for us, what that meant versus service line planning was, how do we strategically plan from the physician end? So we got together as a team. We outlined all of the targets that we approached, something that we really hadn't done. We had a general idea, but okay, who do you target to grow your service line? Who do you target? What are the areas that you go to? And the second part was organizing that outreach. We have everything now into a bucket. How do we categorize and plan who gets the big piece of the pie, or who gets maybe a smaller slice than another? And what is that based off of? What is the criteria rather for evaluating which physician should be matched with which rep and or service line, and tracking that impact? And that is the last phase that we actually are still currently in right now, is tracking it. And Clarify is doing an amazing job of providing us with some of those numbers, and we are mirroring it as well with internal data. So we're able to actually see it from two ends, internally and externally, a picture that we didn't have before. And I will punt it over to Christiana to share some of the filters and lists that we were able to provide as a starting point. Oh, I think you might be muted.
I was. Thank you, April. This is where we really jumped into the strategic planning side of the house with that data. As April said, we sat side by side, and there were two things that we really focused on to give them custom reports that enabled the strategic planning to start. Like April said, we sat down and she had shared with us, we can't just pull a list of physicians by specialty. We need to be more curated than that. We need to identify who are the top referring physicians for specific service lines, hands and feet, total joint replacement within the orthopedic service line. And that's where we were really able to partner together using our physician list profile. We were able to start to identify with them top lists of 50, 100 providers across each of these service lines that had a high referring volume into their system. We were able to sit down with each of the teams, so that way in the moment, teams could pull their list and then they could bookmark it to their page, so that way they could quickly come back to that list, refresh it in 6 months, a year, go down and see what were the exact providers who had those high referral patterns. From there, we were able to work with the team to actually narrow it down further. You've got a list of the top 100 physicians in the market who are referring to a certain service line. How do we narrow that down to the list of targets that you want to work with? And that's where April's team really came in, bringing to the table their community knowledge, their internal data, in addition to what we were already looking at with the Clarify related data. Because as she said, you really want to look at that entire piece of the puzzle. I think we've called it a data pie. We want to look at everything that we can about a particular provider in order to then narrow down to the right physicians to target for those efforts. From those conversations, we were then able to start to export and give these lists out to folks so that way they could really start mapping out what are their plans going to be for how they grow their individual service lines. And this is where they, again, started to combine that entire picture. We know that data is going to give you just a portion of that puzzle. And that's something that April and I talk about a lot. Clarify is based off of claims data and is incredibly powerful with giving you that granular insight into how physicians are referring their patients outside of your organization. But that's not the only data asset that April's team has access to. So we actually focused on then also tying in their internal data, their additional data sources to really curate who are going to be the right physicians for us to strategically pilot with and have those conversations with in order to move the dial. We started to really think through how do we combine that messaging. And what I think was really helpful, April, is we found that we saw similar trends across the board. So it really validated who were the physicians to focus on and what was the message to share there.
Absolutely. And we were able to see a real-time impact. So we could look at a picture of a physician and go, okay, well, it looks like they have a lot of orthopedic volume. It's a family practice physician. Let's go into the office and see what that looks like. Our rep was able to confirm going into the office, absolutely, that is his population. This is the picture that has been painted. And really, it also confirmed our approach. Again, going back to service line planning from a hospital funnel down route, rather than taking that route, we said, let's go backwards. Let's actually track this from the physician standpoint. And the reason for that really came to be was there is massive power in community, and to not leverage the community power of our physicians and the impact that they have directly on our growth, we would just be leaving money on the table. And in order to grow that, we need to make sure that they were experiencing what we were targeting, and were they happy, getting a gauge of okay, this is what the picture looks like. But once we go into the office, it might be a small little group, and he goes, well, I'm actually retiring, but my son took over. And that's when we go, oh, okay, so it's no longer orthopedic volume. Now we've got a mix of everything. And that's where we're able to either differentiate the pictures that were being painted or confirm and validate it and identify other opportunities of growth from those physicians. Absolutely. And then we'll pop over to the next slide. So this is where it gets really exciting. Our matching project. So we took the outbound, top outbound referrals from a provider. So what are they sending out? And what does that mean? Does that mean that they're sending it out because maybe they can't do those procedures? They don't want to see those types of patients? Is it maybe not lucrative enough for them to keep? Or perhaps there's capacity issues. Perhaps they just don't have the time and resources to accommodate those patients. The second question we asked ourselves was, what are the top rendered services? Going back, what are they actually doing in their office and why? And is it because perhaps they have the ability to do it? They can cross against different layers of services and specialties, or maybe that provider actually has a subspecialty that we're unaware of. He may be an internal medicine specialist who subspecializes perhaps in nephrology or in cardiology. And that really is what he focuses on. So from a general standpoint, he's going to be sending everything else out. The question we have to ask ourselves is, what is the referral opportunity based on that profile? So can we leverage a rep that perhaps covers, say, nephrology, and that's who he owns, and we get those tertiary and quaternary cases that he perhaps just can't accommodate or perform? Or do we look at what relationships he has externally and what he's sending out? So is he sending out a lot of urology? And are those relationships set in stone? Are they long-standing providers that he's worked with for many years? Or is he just sending it to where he can get them in because he can't accommodate? the volume of patients that he's receiving requests for. And we based the matches with the rep on those items. So primarily was outbound referrals and top rendered services, and which between those two offered the highest opportunity for us as a hospital and as a clinic site. And therefore, the match was made to the appropriate representative. So here, this graph is actually very interesting. This is the internal graph that we use in real time to see what were we getting from these physicians. We have an idea, okay, what he's sending out, who he's probably sending it to, what he's performing, but what are we receiving? And is that story the same as what he's telling us? He's telling us he doesn't have time, he can't see urology. Well, that's interesting because he seems to be sending a lot to us, but he may not be aware of that. And that's where we worked with our service line leaders and our physicians to say, maybe some education is needed, and we foster this relationship to grow that. So meanwhile, the physician thought that they were sending perhaps general nephrology or urology. It might have been quaternary cases that he was unaware of. And this right here tells us all of our new volume. So on the top left side, you can see total volume. And then if you move over, that's the number of patients are established and new patients. New patients is actually what we were tracking most closely with Clarify. And then you can see the dip in 2020, which I'm sure everybody can relate to that. And then the third part, as part of this phase, was bringing together Clarify's data, our internal data, and our outreach activity. Now, this is the part that we haven't shared with you yet. This is what we'd like to call our secret sauce, if you will, to this cake that we were baking. It was our secret ingredient to really understanding the physician's book of business and how they operated both behaviorally and personally. So if we did 20 calls to a physician, what were we receiving and what did they tell us that they were getting? So for example, we might spend a lot of time, we've done lots of introductions with that physician who was sending us urology or orthopedics, but we're not getting much. Why is that? And that's where we relied really on the reps. Perhaps we might have made a mismatch, or maybe he's a physician who's going to be sunsetting soon and he just hasn't shared that with us. And this insight allowed us to adapt our approach in real time. So we knew that that month we made 20 calls, we didn't get a single referral. Okay, well, what happened? Did he have a contract change? Perhaps another group came in and just wined and dined him, and he had a connection. So we pivot, and that's when we go, perhaps urology wasn't the right match. Let's shift over to orthopedics. What are his or her needs, and how can we provide that in a way that fits that physician or provider best? All right, so here you can see, this is where we piloted out orthopedics. And right here, if you can see the bottom line, that is the outreach activity, that is the volume, and the top line is the clinic impact it had on our referrals and appointment visits. So there was a direct correlation with visits, calls, and outreach attempts with our clinic volume. Now, we'll note this was a brand new clinic prior to the second quarter of FY23. There were 0 patients. We had never even seen a single eyeball in this clinic. So this was new territory for us. But we were able to identify, was the path that we took working? Were the matches that we tested, were those accurate? And if we do more visits, does that mean that we're going to get more referrals? Not necessarily. We wanted to really gauge a measure on the health of the relationship with that physician. And this is a testament to that. So as you can see, although more introductions equated to more volume, we didn't have to do that many more. It wasn't beyond what we were actually getting. And that told us the relationships were working great. All right, so I'm gonna share this with Christiana and pass it over to her. She's gonna give you a little bit of insight into the provider impact that we were tracking and some of the key insights that pieces of nuggets we found during this project.
Yeah, thank you, April. So this is, I think, we're in the final stage, phase 3 here of this project, and this is the one that probably lasts the longest. And it's something that April and I really brought early on into the conversation to make sure that not only did we identify what these key measures were going to be before we started, but we used several different resources, as you could see, in order to track that outcome. So one of the first things that we really looked at was that overall provider impact. What impact were we making on the physicians? We focused particularly on narrowing in on the physician-to-physician relationships within the market. What's happening really upstream in those patient patterns, and how can we identify where we're seeing that strength encourage or that strength increase between the providers in order to further align them to our organization downstream. Another thing that we really focused on, April, was that mature health of the relationship. And this one was a little bit more subjective. So we actually started to look at, well, what are the relationships and what are the factors that go into the different relationships that our team has with each of the providers in order to encourage a healthy relationship across the board. So we started to look in and see, where are we seeing those conversations start to turn up? Where are we seeing, we're hearing back from the providers feedback in order to improve that patient pathway, and making sure that we were documenting it, because while that's harder to quantify, it's an incredible success and it's one that's worth sharing. And if we're able to help further progress that relationship health, we can inevitably turn a dissenter or splitter into a loyalist.
Absolutely. And that is exactly right. Our goal really was to convert these physicians. It was to take them over to the bright side from the dark side. We wanted to know during the conversations with these physicians, what kind of words came up, what really caught their attention, and were there certain either keywords or messaging that drove the impact of the referral. And we did an interesting little analysis during this with our Salesforce and our CRM platform. We looked at what were the words that were used most with these pilot physicians that we had tested this project out on orthopedics. What stuck with them? And we found some interesting information that it really varied depending on the age of the physician, the location that he was in, and some of the needs that he had just from a general practice standpoint, things like contracting, practice size, ability perhaps to take call at a hospital. And we thought to ourselves, we aren't leveraging these conversations enough in our hyper-personalization. Should we be able to look at that relationship and perhaps maybe either mirror it with them or foster it internally? And we know definitely that the best reflection of progress is looking inside, right? If we look internally, not just what are we getting, but what are we looking at ourselves? And we found that some of our physicians weren't as perhaps loyal as we were hoping or maybe expected. And were we naive to think that we were expecting that of them? Rather than asking, we're tailoring this to community physicians, we should also be tailoring it to our physicians that are our faculty. Just because they are on our staff does not mean that they are loyal. They're also human at the same time. And just like other providers, they have factors outside of their control that impact the referrals that they do send out.
Yeah, and it's been really interesting to start to hear some of that, because I think one of the things that April and I keep really close to heart is it's not just going to be, the overall growth from a volume-based perspective, but what is the long-term relationship? What are the long-term factors that are changing that are going to enable Keck to really, across the next year, 3 years, 5 years, grow, particularly with the younger physicians that they've been having conversations with? So the last two things that we have here around the value that we were focusing, we're really thinking about how do we grow that reach? So the one other piece that we measured were what are the number of new physicians that we reached and engaged with through this process? As April had shared at the very beginning, one of the things that was eye-opening as we started to pull those target lists is how do we really identify the right physicians, and how do we make sure that we're not talking to the same providers each time? So we ensured that each of the liaisons had a number of net new providers that they were continuously targeting and having conversations with. And then the last piece that we really focused on was that alignment. So ultimately looking to see before and during and after, how are we growing that overall alignment? both using internal referrals data as well as that claims data from Clarify to say we're moving, the targeted physicians' growth efforts and their overall referral volume by X%, which can yield an organization several dollars, as you'll see in the next couple slides.
Absolutely. And another note on that. Oh, sorry, Christiana.
No, keep going.
I wanted to share an interesting part about this was we found that going back to the referral opportunity, we had a physician perhaps that had a great opportunity around cardiology, but wasn't sending us a whole lot. And was that match, again, mismatched? We sent in our orthopedic representative into that office, and there was a particular physician who absolutely loved golf. He lived, breathed, ate, and slept golf. Well, the providers we were introducing to him weren't really big golfers. So again, going back to the match, we thought, you know what, let's actually match him with a different set of physicians in another specialty who happen to all golf. We saw the referrals for that particular physician just skyrocket because of the commonality that they had in a hobby outside of work. So they were able to find common ground, and we actually garnered far more referrals based off of the relationship that we identified in that outreach. So on surface, we thought it was one thing, but once we got into their four walls, we learned that there was a bigger opportunity to be had.
Yeah, and it's combining all of that together, and that's how we really start to drive. So I think you've heard a couple things as we've been going through this. We were really specific with curating those target lists. We didn't curate those target lists absent of those relationships and the community knowledge that the reps had. We actually used it in tandem. And because of that, April and I were really able to see sooner and more drastic results when we started to look at the overall impact on the organization. Because since we have that very narrowed scope in the outreach list, we're actually now starting to see overall impact. And that's where, I think it starts to get to where we are today, which is starting to track that impact. So there were a couple different things that we went ahead and looked at. The first thing that we started to do is we started to link visits with providers, started to identify who are the providers that were targeted. And let's actually look to see if we see any spikes across their overall in-network alignment, or keepage rate, as we call it at Clarify, to the University of Southern California Keck Medicine overall organization. And this is where we were able to see that for physicians that were not only on those target lists, but were specifically targeted for certain services, we were actually able to start to see those keepage rates increase. And this is something we're continuing to track. The next phase that we said is, well, let's go a layer deeper, because we know that while there may be 50 physicians on this target list, not every single physician may have had a meaningful conversation or had several conversations with the liaison. So we actually started to say, well, then let's actually look and see which of the physicians are visited the most or had those meaningful relationships that we've been able to document from more of a qualitative perspective. And do we see those results kind of vary in terms of that performance? This is something that we're continuing to track, but especially as we start to link via the Salesforce Connector app, what's documented in Salesforce from those visits to the Clarify data, we can continue to trend the overall insights and show the success of April's team back to her leadership organization.
Definitely. Thank you, Christiana, for that. And the biggest insight, like she mentioned, is we're now able to forecast not based on predictions that are general. We're able to forecast the future of the referrals and the health of the relationship based on the physician profile alone. So our reps could tell you by physician specifically, yes, it looks like they have this on paper, but really their population is completely different. And that's where we work with Clarify to forecast our keepage rates, our volumes, the trend lines, and the goals. So we're setting trend goals now and volume based off of our insights into these physicians' book of business. And that is a view and advantage we didn't have before.
Yeah, and that's where April and we got really excited, I think, looking at the numbers and starting to say, not only before we started this project, what is the overall impact going to be? And we used a tool we have at Clarify that we call our ROI calculator, we're able to start to look and see, okay, for those targeted physicians, let's start with the low-hanging fruit. Those that are already employed with Keck that should be referring to our organization. Let's actually look at their overall book of business, what that potential impact can be, and actually start to size out the large impact our organization can have. So this slide here starts to summarize just that. When we narrowed into the about 40 targeted physicians who were already employed, we saw that overall they were incredibly loyal. In fact, when we looked at the referrals just to facilities, you can see here that 86% of the time they were referring in network, which is great to see and an incredibly high alignment. But April and I are always thinking, how can we improve that? How can we get that higher? So we actually started to focus on those upstream referrals, those physician to physician referrals. And we saw that from just those 40 physicians, there were about 2,500 referrals that were going to competitor physicians. So right upstream, we're seeing patients being sent out of the network. So we thought, let's start small. Let's say we can maybe capture a portion of those referrals that are being leaked out of the network. Let's say we can capture, even 5% of those referrals that are leaving. What does that overall impact look like? Because 5% may not seem like a lot, but does that impact our organization? And that's where we were able to say, okay, well, if we take that 5% of that competitor leaked volume, we actually were able to put a dollar amount on that figure. And if we take a conservative estimate on what that overall impact is using an $1,000 per case estimate, we actually were able to quantify that if we were just able to move and the referral patterns up by 5% for just these employed physicians, that could yield over $1.4 million of revenue for the organization, which is a pretty powerful number for us to see right early on. And so we thought then that's helpful. That's the small group. We're going to try to achieve that. We're setting these goals of 2 and 5% to grow the referral pattern. But let's actually think bigger, because most of the physicians on the initial target list were not employed. And this is where there is the most leaked revenue, most leaked referrals that are up for grabs within the organization and within the market. Knowing that physicians who are not employed are harder to sway, we actually set even lower parameters. So we said, well, let's say we can capture 2% of that out-of-network referred volume. What impact does that have? Changing a provider's or 2% of the provider's retargeting behavior patterns feels like an attainable goal, but does that generate results for our organization? Again, using that similar logic where we're able to apply that estimate and apply that dollar figure to that potential additional 2,000 referrals, we can see that this is going to have huge amounts of overall impact for that total volume for us to continue to capture. This is something that April and I have done early on, and what's been really exciting is I think starting to see the overall goals that we set for these physician liaisons and starting to see them achieve that 2%, that 3% increase.
Exactly. And it comes down to, you don't need necessarily a large book of volume of community physicians referring in. You just need a loyal set of physicians with good relationships and processes in place in order to have these referral pathways be efficient and healthy in a manner that is tailored and personalized to them. So 2% also means for us, not just one physician with a lot of referral opportunity, or he's got lots of cardiac, so that's what we want. We want to take, everything that he has the largest amount of. Rather, looking at it and saying, where is the gap of need for him? And is that a larger opportunity, perhaps, than putting all of our eggs into one bucket? And can we actually pick out the services that are most in need, and will that garner the largest referral opportunity for us? And in short, we've really seen a trend line move, especially with orthopedics, by matching these physicians to the appropriate rep and to the appropriate physician.
Absolutely. And that's where we've kind of come to where we are today, which are those lessons learned that we've really heard throughout this process and throughout our conversation. So a couple of things that we've kind of already hit on throughout this. We've learned to be really targeted. And that was something we did from the get-go. So we really sat down and understood what is the business objective, what specific services within orthopedics do we want to grow, what are the gaps of those physicians, and use that to set the plan and the path for how we really targeted this project. We also were really thoughtful about the different data sources we used. We utilized the claims data that comes from the Clarify Health solution, but April also didn't just look at that in its entirety. She combined that with her internal data, additional data sources for us to paint that full picture, as well as what's documented from conversations her liaisons have had historically. We also were really, really thoughtful about data sharing. We had and encouraged the liaisons to have the data shape their conversations. If you see a provider is leaking for total joint replacement, use that as a way to ask particular questions. Is it because of wait time? Is it a relationship you have with a physician? Like April said, is it because of a hobby that goes on outside of the four walls of the physician office? Let's understand that and let's use the data to ask those questions so we can find those barriers. And then that, I think, starts to transition into the best practices that April's really been empowering for her team, which are the goals and campaigns. So I'll let her talk a little bit about both of those.
Definitely. So the goals for us really were individualized, not just to the community physician that we were trying to drive referral growth, but for the service lines that we represented. And each service line had a big surprise, a common goal. We just want volume. We want to get busy. We want surgeries and we want to see patients in the office. And one imperative we had to share with them, it is about progress and not perfection, fostering the relationships between the physicians and leveraging perhaps external factors that might be out of our control. For example, we found one physician, it was a GI physician on Fridays, seemed to send all of his business out, but we never saw it really any other day of the week. But our GI clinic confirmed getting lots of calls on Fridays. Well, we found out he happened to go out of town every single weekend for a little mini vacation. He did not want to be bothered. So if his patients had not gotten appointments or referrals, within his office or with his most closely relationship community physicians, he would send it to us because he knew we would take it. So rather than spending lots of time during the week or during the month, we knew we could call him on a Friday and he would more than likely have something for us. And it was taking small bits at a time. And really the campaigns, the tactical messaging strategy that we took, that was tailored in a couple different ways. One was using the Clarify data. The second one was our internal data. And the third one was our Salesforce data. And rather than looking at volume of documentation, and we'll go into this actually in the next slide, we looked at the quality of documentation. As a team, we sat down and we looked at our word cloud. Okay, what words are we using most? How can we grow based off of that? And we came to the agreement actually on a couple different items. Well, first, let's look at the types of physicians and what their behavior patterns are. We're very fortunate as an academic institution to have access to research and lots of layers of different items that we can pull from. One of those was a physician focus group that our marketing team hosted. 24 community physicians were invited and paid for their thoughts, which I'm sure many of you can agree on that, you don't have to pay physicians for their opinion, they will willingly give it for free. But with that, we also found the collaborative referral networks with the physicians. And that network was based again off of the representative and the needs of the physician. So although the needs were large in one area and he might have a lot of cardiac, we wanted to tailor to his exact need, not pushing a service line based on what is coming from the top down. What are his needs? Hyper-personalization. And the third one is creating curated campaigns. What is the messaging we're going to agree upon? We had, one of our ortho reps, I go back to her, who she would get questions perhaps about cardiology. And rather than punting it off to 3 or 4 different reps each time a question came up, she was equipped with the general knowledge of how to just, have a referral made and connecting them with the right people internally. And that alone, just having it in her back pocket, helped her grow the relationship with her physicians. And then the second was layering our Clarify data, identifying which charts are we going to track in order to trend these provider volume trends and behavior impact. So for example, if the physician again had that hobby of golf and we matched him with a couple of different golf buddies, that's what he really wanted. Are we going to see the needle move both with Clarify and internally? And then of course the visit logs. How many visits was it taking, or how many calls in order to have a return? And was it worth our time? And that is something we were not just assessing on a quarterly basis, but on a weekly and monthly basis as well. We would look at how many calls we actually made to certain providers, and are we getting the referrals that we're looking for? And that's where our internal data came in handy. And we would compare it to clarifying, well, the opportunity looked like it was there. However, as of right now, this physician probably isn't in a place to foster the relationship that we are looking for. And then third was identify the providers that had the largest improvement. Who are our key partners in this game, and how can we leverage the relationship again to that 2%? They are our 2%ers, as we'd like to call them, into our campaign and our growth.
Awesome. So a lot that we've learned, and this will continue to evolve as April shared. Knowing, just looking at the time and knowing we've got a couple questions, I'm actually going to jump to some of them. So one question that we got through April, was around when you were describing that you matched the referring provider to the specialist provider, what exactly were you doing? Did you do any or make any introductions or cultivate a peer-to-peer relationship? Are there referring physicians then communicating directly with them? What did that process look like?
Absolutely. So the match process, in short, was based on first looking at the physician profile and clarify rendered services and outbound referrals. Between those two, which had the largest opportunity? Was it rendered or was it outbound? If it was outbound, why? If it was rendered, was it because, what did that book of business look like? Was it really high level specialty care, or what were they providing? And the insight for the DRGs and CPTs really is what gave us the answer. The second part was the rep going into that office and having an intake assessment with that physician, finding out the answers to the questions. Again, why are they sending out certain things? What do they like to do? What are the drivers to the relationship? How long have they had that in place? And as a provider, what are their largest needs, and what do they want to grow the most? Do they have an issue where they're sending patients out and they're not getting them back? What is their leakage rate? And then third, it is, yes, a peer-to-peer relationship and introduction. And that match in particular between what we call our faculty physician and the community physician was based off of things like the hobbies. And we would go in and go, okay, what's their personality like? And if we can leverage a personality match, that will actually garner a larger referral volume for us than if we just pushed perhaps a service line that they weren't interested in.
Awesome. Thank you, April.
Yeah.
Another question that we got through from the team, were there any challenges in getting your liaisons to document diligently in your CRM? If so, how did you overcome them?
I love this question. And I think the reason I love it so much is we all experience the same challenges around CRM. From the rep standpoint, we're constantly trying to just get it in. But we set our targets pretty low as far as volume entries go. And the reason for that was we wanted to have quality documentation. And I mentioned earlier, our liaisons and ours, we sat down as a team together and we said, okay, let's identify a couple keywords or phrases, but more so keywords that we are going to agree upon to use that we want to track. So hobbies was one of them. We wanted to also track perhaps what was the contract barrier, referral barrier. So we pulled out those keywords, and we're still actually in the process of doing that right now. And we're tracking each position to see which one appears the most. And we're doing just a quick word count, how many times it appeared. And rather than documenting diligently, it's documenting the information that is relevant to driving the referral volume. And we keep that number low so that things like, sent a text message acknowledging, really that for us is time that we want to divert into more quality conversations.
Awesome. Thank you, April. And just looking at the time, I am so sorry that we have not gotten to all the questions. I do want to say, just looking at the end of time, thank you all so much for your participation in today's session. We really hope you enjoyed it. If you have additional questions about Clarify or the project that April and I have worked on, our emails are here on the screen. Please do not hesitate to reach out to either one of us, and we're happy to have a conversation. I'd also like to make just a reminder to complete the survey that you should receive at the conclusion of the session. So thank you everyone again for joining, and I hope you have a wonderful rest of your day. Take care. Bye-bye, everyone.
Bye-bye.